October is Breast Cancer Awareness Month, and the Nebraska Cancer Coalition is working to increase awareness of the importance of breast cancer screening. We're joined today by Dr. Kevin Yiee. He is a radiation oncologist with Nebraska Hematology Oncology. Thank you so much for being here today, Dr. Yiee.
Thank you, Scott.
Well, it looks like the main risk for breast cancer is being born a female. Breast cancer is about 100 times more common for women than for men. And we do know that breast cancer is the fourth leading cancer killer in Nebraska. But breast cancer death rates can be reduced by almost half for women who participate in breast cancer screening. So tell me, Dr. Yiee, what are some of the factors that put women at higher risk for developing breast cancer?
Scott, there's a couple of things. One of the main things is when you have a relative that has breast cancer. 90% of the time, we don't know why people get breast cancer, but 5 to 10% of the time, it's related to genetics. And so having a first-degree relative, meaning if your mother, sister, or daughter had breast cancer, that puts you at twice the risk of getting breast cancer yourself. Or if you have multiple first-degree relatives, that can increase the risk by 3 times. And then cousins, grandmas, other relatives can also have an increased risk. So genetics does play a role in about 10% of the breast cancers.
Well, certainly that is something too. So when you come in and you are coming in to get screened, you really want to know your family history before you come in, don't you?
Right. I think it's important to try to figure out as much as you can, why or what type of cancer, a grandmother may have had or some other family members, rather than just knowing that they have cancer, but trying to pinpoint the specific diagnosis.
Is there anything that women should be aware of when they get their mammogram done?
Yeah, so breast cancer is one of the few cancers that we have an excellent screening tool, colon cancer being the other one, which we do colonoscopies. But for breast cancer, a mammogram can help us try to detect the cancer when it's still in the early stage. So cancer goes in different stages. Stage 1 is the earliest. And if you can catch cancer in stage 1, we have oftentimes over 90% cure rate with those. And very few cancers can we say that about. And so for the screening mammogram, some women have what we call dense breasts. Dense breast means you have less fatty tissue, but more connective tissue, more milk ducts than other women. And that oftentimes can obscure the ability of us to be able to see early lesions. And so when we can identify women have dense breasts, and that's seen by a mammogram, then that way we can lead to more imaging studies. So we can do an MRI, an ultrasound, or a special 3D mammogram. And using those new tools that we have now, we can help detect cancer in early stage.
Well, this is Cancer Awareness Month, and certainly there are a lot of opportunities out there for women to get in there and do that. The procedure itself, I think, used to be really scary for a lot of women, but not so much anymore. Is that right, Dr. Yiee?
Yeah, we have much more precise tools these days. Like I said, some mammograms now, we do what's called tomosynthesis. It's a 3D mammogram that allows us to get even more clarity. The radiologists we have now are oftentimes specially trained just to focus on mammography. And so there's just so many more tools that we have. And, one of the things that we recommend is that you start mammograms at the age of 40. And that's the standard recommendation these days. And by getting your first baseline mammogram at 40, then we have future scans to compare with. For women who have had a family history or other risk factors, we would recommend also starting at an earlier age. And so there's other risk factors too. People who start menopause at a later age, or people who start menstruating at an earlier age, having that increased hormone production can also be a risk factor. So there's a variety of things that may lead us to have you start mammograms earlier than 40, but that's something to discuss with your family practitioner about.
And is it recommendable, Dr. Yiee, that it's a consistent thing, that women do it pretty consistently all the time?
Right, because usually we just do it annually, and so if you do it annually, then that's often a sufficient amount of time between mammograms to be able to detect something early on. And then the other thing that can help in conjunction with that is just the self-exam, and what that involves is alerting your physician if you feel something while you're in the shower. Sometimes a person's partner may feel something too, and so if you ever feel a lump in your breast or in the armpit area, it's important that you let your providers know, because that can lead to a mammogram earlier than you normally would too.
All right. Very good. Well, thank you so much. He is Dr. Kevin Yiee, a radiation oncologist with Nebraska Hematology Oncology. Thank you so much for your time today, sir.
Thank you.